We are excited to be working at Recovery Ways, the study that will focus on substance abuse recovery is formulated to identify a better way of treating patients.
One of the reasons we're excited about our experiment with Genote in being able to assess this new modality is because we have seen that treating these disorders is not effective from a psychoeducational standpoint. A lot of the other modalities that we use are experiential. We help patients understand their trauma, how it's affecting their bodies and their emotions and their thinking. Our other modalities that are done through occupational therapy, neurofeedback, all go towards resolving the physical symptoms, the fight, flight, or freeze effects of trauma.
We look at life skills, if you think of it as a pyramid, that bottom layer of that pyramid really being self-regulation, and how our program here at Recovery Ways teaches it is through sensory, and we use rooms that are specifically designed to help the brain shift into more neurologic organization, really saturated with sensory input. It's not subtle. The sensory input in the room is not subtle. And so sensory and also mindfulness, and that's kind of the scaffolding piece, helping patients practice these skills and then be aware that they've been successful in these skills. And then, having created the program here, we focus on all the senses. There's 8 of them. We focus on all of them. But the sense that had been the most lacking, the least robust, was our auditory sense. And so when we came across Genote, and when I was introduced to the Genote team, I was just delighted because this is the piece that's been the weakest in this program. It had been kind of guided by preference, so what's patients' preference in music, and looking at different kinds of alerting versus calming music, but that was the extent of it. And to the Genote guys' appall, we were using just Pandora, and so it was really an exciting, kind of beautiful partnership.
Genote's role in this important study is to provide the hardware, is to provide the music protocols, and also to train the staff. Additionally, we have assembled a third-party independent team of statisticians that will give us the numbers.
Doing the study and adding in a very well-studied, very robust piece of the auditory input of music as a way to heal. And so I'm really looking forward to the study. We're looking at physiologic parameters, so the stress kind of response, does that improve in the room and improve with using the health music, with Genote music, and then also looking at translating that to improve sleep, which a lot of our patients struggle with, either also because of the drug choice during the detox phase and then after also. And so really supporting them in sleep and then supporting them in distress tolerance. And we're also looking at anxiety, agitation, and pain. And so those are the areas we're studying, and I'm really looking forward to the results.